everyone, I am Dr. Naveen Polavarapu. I am a consultant transplant hepatologist and gastroenterologist at Apollo Hospitals, Hyderabad. So today we're going to discuss about something very commonly that we see in our practice, which is liver disease and liver problems. So what is jaundice? So jaundice is nothing but noticing yellow eyes or yellow skin or yellow pigmentation on the nails and the yellow urine. This is what we call a jaundice. See, jaundice is a symptom which happens whenever the liver is affected. So jaundice is nothing but a symptom. So like when you have a fever, you get, when you have infection, you get fever. Similarly, whenever you have liver problems, one of the symptoms that we see is called jaundice. So what are the causes of jaundice? So as I said earlier, jaundice is one of the symptoms which we see when liver is getting damaged. So when liver functioning is not good, you can get jaundice. But also when the bile which is formed in the liver, when it is not draining out of the liver into the bile pipes, into the intestine, then also you can get jaundice. For example, people who got stones in the gallbladder, which may have slipped into the bile pipe, or any pancreas problems or pancreatic blockages, cancers in the pancreas, or any stones in the bile pipe can also cause the jaundice. So in other words, whenever the liver functioning is not good, you can get jaundice. Whenever the bile flow, the blockage to the bile happens, you can also get jaundice. There's also another reason why people can get jaundice, which is when they have problems with the blood cells, the red cells, which are breaking up very easily, what we call in medical terms hemolysis. So whenever you have the red cells which are very fragile and they break easily, that can also result in jaundice. So whenever a patient comes with jaundice, we have to start evaluating all these conditions where jaundice can happen. What are the symptoms of liver disease? See, liver is a very big chemical factory. It does more than 500 to 600 different functions. So whenever the liver is affected, all the functions, as I was mentioning, get damaged. And as a result of it, the liver becomes sick and you will start getting the symptoms. The most common symptoms that we see are the jaundice, as we discussed, but people can also come with, especially when they develop chronic liver disease. In other words, liver has been extensively damaged very badly, as the damage continues to happen, leads to scarring, and that scarring leads to further progression to what we call in medical terms cirrhosis. Then all the complications starts happening. Like people can present with swelling of the tummy. In medical terms, we call it as ascites. They can also present with swelling of the legs. They can also have blood vomit or having blood in the stools or black stools. They can get drowsy, they start losing muscle mass, they become very weak, they can't even stand properly. So these are all the complications that we see in the end stage liver disease, what we call cirrhosis with its complications. So unfortunately, by the time the patient presents with these symptoms, it is too late, and that's why I keep saying always that liver is a silent killer. The damage happens silently, and only when it falls off the cliff, then you will start seeing the symptoms, like as I mentioned before. So I would advise everyone that please do not wait to look out for the symptoms of liver disease. You should get yourself actively checked for any liver problems. What are the causes of liver disease? See, as I mentioned, liver is a big chemical factory and a lot of functions happen in the liver. If I had to say the most common reasons why liver can get damaged, there are three big reasons. One is the alcohol, which I'm sure a lot of you are aware of it. Alcohol certainly damages the liver. The second most important reason is the viral hepatitis, or particularly the hepatitis B and C viruses, which can sit in the liver and can cause damage. And the third most bigger reason, and in fact I would say the most common reason, and which is very dreadful these days, because the fat in the liver is fatty liver that we're seeing is growing in number, particularly India being the capital city of diabetes. We're seeing so many patients with fatty liver. This fatty liver progresses towards scarring and then to the cirrhosis, similar to what alcohol or the viral hepatitis does. So the bigger elephant in the room right now is the fatty liver, And I think we should all open our eyes for this fatty liver so that we understand this the big tsunami that we're seeing about the fatty liver progressing towards the further damage to the liver. Along with these three reasons, there are so many 100 different reasons why liver can get damaged. For example, our own soldiers of the body which protect the liver can assume or sense that the liver is an outside organ and can start damaging the liver. Along with this, excess copper deposition, iron deposition. So there's so many other reasons why liver can get affected. So it is important that we understand the reason so that we can give the right treatment for these patients. So anybody who has got liver diseases, please do consult the hepatologist or the liver specialist so that we can assess all these causes in detail so that we can give the right treatment for you. How to prevent any liver damage? See, liver is, as I said, is a very big chemical factory which just does a lot of functions. So obviously, it is a very important organ. In fact, it is the largest organ, solid organ of the body. So it is important that we protect and prevent it from having any problems. Now, as I said, it is a chemical factory, it is a metabolic factory. So all the food that we eat, which goes through the intestines, they get digested, they get absorbed, and then they get metabolized into the liver. So it is important that we don't load our liver with lot of calories and lot of the food, which will obviously cause more damage to the liver. So I think the most important things that you look at is, one is the diet and exercise. This is a very common thing for rest of the body, of course, but liver being the chemical factory, it takes the bigger brunt of compared to the rest of the body. So diet and exercise are the most important things that will help in keeping your liver happy. And I cannot stress any more than what I said, that these are the most important things. The other things that we need to look at is, please keep yourself checked on an annual basis to look for any hepatitis. And I would suggest that all you patients, all of you should get yourself vaccinated for hepatitis B. The hepatitis B is a virus which will attack the liver. So before it attacks the liver, if you actually get yourself vaccinated, then you can prevent this virus. And the hepatitis B and C viruses are the most common reasons why people get liver cancer. So by taking these vaccinations, preventing these viruses, you would also prevent yourself from getting any liver cancers. So vaccinate yourself, have a diet, a healthy lifestyle with good diet and regular exercise. So these three things are the most important things which will keep your liver healthy and happy. Along with this, of course, get yourself regularly checked for any liver problems. And as I said, with simple blood tests, you should be able to pick up any problems. So ladies and gentlemen, today we discussed a few important points about the liver disease, how to prevent liver diseases, but more importantly, how to also get yourself checked of any liver problems and any complications. So do not hesitate to get yourself checked annually for any liver related issues, and get yourself vaccinated so that we can prevent any deadly viruses attacking your liver and causing complications like liver cancer. In fact, let us all pledge that by 2030, which is the mission of the World Health Organization, to keep our world free of hepatitis B and C. So let us all get ourselves checked and get vaccinated for the hepatitis B, and also check for hepatitis C, because there are excellent treatments available. If you do have hepatitis C, it can be a treatable. It is a treatable disease, and we can eradicate this disease. So get yourself checked regularly for hepatitis and also for liver diseases, and do not hesitate to contact liver specialist if you have any issues. And the other important thing is, do not have the myth that liver transplant is a hopeless treatment. Things have changed a lot. Please keep your eyes open. Understand, know about liver transplant, and only when it is needed, of course, we should do a transplant, but that is a life-saving treatment, and do not resist not getting a transplant when your liver specialist suggests that you need one. Thank you.